Please welcome Ms. Valerie Jarrett.
Thank you, Nancy, for that very gracious introduction. I really appreciated it, and I'm delighted to have shown up here today. It's a thrill to be with you. And Nancy, I want to highlight not just what you did to pull together this terrific group, but for your willingness to roll up your sleeves and work hard each and every day, and to your leadership on a very important issue to us all. Congratulations. If we could give Nancy. I also want to thank Kate Michelman for her leadership as your past president, to the co-chairs here today, to your board of directors, and to all of you who are here at this very important moment. Because what you're doing is you're working on behalf of women all across our country. And I want to convey to you on this important day the President's support for your efforts to ensure that decisions about women's health are left to a woman, her family, her doctor, and her faith, period. Period at the end of that sentence. President Obama has been pro-choice throughout his career, as a state senator, as a U.S. senator, and today, as the President of the United States, he remains firmly pro-choice. Now, I think everybody knows that the President was raised by a single mom, and he lives in a household with a wonderful First Lady, Michelle Obama. Shout out for Michelle, thank you. 2 wonderful, darling daughters, and a mother-in-law. So in a household such as this, can it be any wonder that our President is focused absolutely on improving the lives of women and their families? You may remember that the very first bill that he signed when he was president was the Lilly Ledbetter Fair Pay Act. And he believes in the common sense notion, get this, that women should get equal pay for equal work. How about that? A little over a month later, President Obama signed an executive order establishing the White House Council on Women and Girls. The council's purpose is simply to ensure that all of the federal agencies are working together to address the needs of women and girls in the policies that they adopt, the programs that they create, and the legislation that they support, something that has never been done before in a prior White House. So rather than just having one person whose job it is to focus on women and girls, the President has tasked his entire cabinet to focus on this important issue. And I am just terribly proud that I chair the council. And I know many of you know my partner in that effort, Tina Chin, who's the executive director of the council, and also very importantly, the office director for the Office of Public Engagement, that is responsible, as Nancy said, for reaching out broadly across our country and engaging the American people in helping us govern, because after all, we are here to serve you, not the other way around. So, President Obama has been working hard on another issue that is greatly important to us all, and perhaps you've heard a little bit about the health care debate that's been going on for the last couple of months. And if any of you have any doubt about the importance of this issue to women, I ask you to consider just the following 3 facts. First, women are more likely to work in small businesses or part-time, the kinds of jobs that are less likely to provide insurance benefits to begin with. Second, many health insurance plans fail to cover routine preventive care such as pap smears and mammograms, basic screenings that are critical for a woman's health. And third, today in some states, it is legal to deny a woman coverage because she's a victim of domestic violence. And believe it or not, women in this country have been denied coverage because they've had a C-section or have been pregnant. Those have actually been deemed, as Nancy alluded to, pre-existing conditions. And can you believe that in a recent study demonstrates that a 25-year-old woman is often charged up to 45% more than a 25-year-old man for coverage? And at age 40, that differential goes up to 48% more. These are just simply facts that are not widely known and seem incredulous to any right-thinking person. So for those of us who just care deeply about the lives of women, health reform just simply could not be any more urgent. So I say, let's ask our series of questions. If you have a pre-existing condition, should you be denied health care? No, right answer, thank you. If you get sick or your health insurance cost becomes too great, should your insurance company be able to drop your coverage just like that? Okay. Should your health insurance company be able to raise your premiums year after year after year? And if you lose your job, should you go without health insurance? Well, obviously, no. That's why President Obama is fighting so hard for health insurance reform that will make health care more affordable for those who don't have it, that will make it more effective for those who do have it, and that will lower the costs that are so devastating families, businesses, and adding to our national deficit. The idea here is really quite simple. If you don't have health insurance, you should be able to buy it through an insurance, a marketplace that offers a wide range of options. Now, I know that there have been questions about how the bill is working its way through Congress and what impact it will have on a woman's right to choose. The answer is nothing in these bills and nothing the President will sign would change existing policies or erode the choices that women have today. If you have insurance you like, then nothing about health reform is going to make you change your plan or change your doctor or any of the other myths that you may have been hearing about over the course of the months and weeks that have gone by. The goal, of course, is simply to protect you. Yesterday, we took a very important step forward towards health reform. As I'm sure you've heard, the Senate Finance Committee, the fifth and final committee responsible for health care reform, passed its proposal. Although the bill is not perfect, we are closer than we have ever been to achieving this important goal. And we intend to reach the goal when? This year. Finally, this year. We have waited long enough for quality, affordable care, and we shouldn't have to wait not one more year until we get it done.